You are welcome to my channel. Today I'll be presenting a poem on the liver, and it will be titled Letter from the Liver. My name is liver. I'm the largest organ in your body and wedge-shaped, living at right upper quadrant below the diaphragm. My size can increase with age, but larger in fetus than adults proportionately. I should be 5 cm in the 5th year and about 15 cm in adulthood. I could weigh 1.5 kg in men and 1.4 kg in women. I have main right and left lobes separated by falciform ligament, with other lobes like caudate and quadrate lobes. Each lobe is further divided into 8 segments. Dear higher and lower animals, it is time for you all to read from me after serving you for all seconds, minutes, and hours of your lives. Some of you, particularly the higher animals, sometimes do ask yourselves or your peers, do you have liver? Or you sometimes say he or she doesn't have liver. You are trying to imply that liver is equivalent to bravery. Okay, are they wrong? You said yes. Your friend said no. Well, it is subjective, right? After reading through my letter here, you might have one voice to say, yes, having liver is equivalent to being brave. Blame me, not the other organ or organs. Your yellowish green eyes or skin, or you are bleeding everywhere, or there is itching all over. Don't blame the part of your body that will be showing all these signs and symptoms. It is mostly and likely because I'm sick. In fact, I can affect your entire body from your head down to your toes. Sickness. When I can't function well, you will notice certain signs and symptoms. It means that I can't do many things and the deficiency will manifest openly. And you will notice that as follows. Most times, what you see will not be specific to me as liver per se. And in that case, you might have fatigue, telangiectasia, bleeding, bruises, itching, jaundice, weight loss, nausea, vomiting, anorexia, and muscle cramps. But most times also, the signs and symptoms you are going to pick will be specific to my own problem. Your head and neck region can present in the following ways. Your brain can come down with hepatic encephalopathy. In that case, you have sleep disturbance, you become confused, you have hypotension, you can lose your consciousness or you can even go into coma. Without correction, you might die. If anyone sees your face or you look at yourself in the mirror, you might see jaundice. And the jaundice might not be limited to the eyes alone, even the skin of your head and neck. The mouth can give the people around you fetal hepaticus. Still around your head and neck region, your cheek can become swollen, known as parotid swelling. There might be esophageal varices presenting with hematemesis. And lymph nodes are not spared because they could become enlarged. Your upper limbs are not safe from signs and symptoms of my sickness. From the wrist to your hand, you can have hysteresis, which is a form of flapping tremor when the wrist is extended. And from your hand, you can see me fully. You can have palmar erythema, finger clubbing, hypertrophic osteoarthropathy, Dupuytren's contracture or terry nails. The chest region will also manifest signs and symptoms of my sickness, with hair loss, including the axillary region hair loss, gynecomastia in men with enlarged breasts. Because I'm weak now, I cannot metabolize those estradiol. Spider angiomas, or people call spider nevus, or telangiectasia, all could be seen in your chest region. Your abdomen will also give you the clue that I'm sick with abdominal pain. Caput medusae, ascites that will give you the sign that your tummy is swollen. Spider angiomas, nevus, or telangiectasia. There may be a lot of scratch marks from pruritus, hepatomegaly, and splenomegaly. Upper gastrointestinal tract bleeding can all occur. The kidneys will feel the heat. When I'm down, there can be hepatorenal failure. The urine produced could become Coca-Cola colored or dark urine. Profound renal failure could add to the pruritus, and there might be swelling all over the body. The more pronounced are the lower limbs. The perineum. You can notice hemorrhoids just because I'm sick. And in men, you can notice testicular atrophy. If you check your stool when I'm sick, it might be black, tarry, or melanoma stools. Stools could be pale, or you have saturia where you find it difficult to flush the stool in the toilet, all because I'm sick. Your reproductive system will know that the largest organ is suffering. Like I've said just a while ago, that the men can have testicular atrophy. There might be decreased libido or impotency. The women will complain about irregular menses, and families will suffer infertility. There might be gender confusion because male can have feminization. My functions on a good day will be the following: Deamination of amino acids. The amino group will be converted to ammonia, leaving carbon and hydrogen behind. That could be recycled or be oxidized for energy. The produced ammonia will further be converted to urea and uric acid when carbon dioxide molecules are added. The urea and uric acid produced can safely diffuse into the blood and be excreted in urine. Part of my function is to synthesize certain stuff. Synthesis could include albumin production of all crossing factors except factors 8 and von Willebrand factor. I have the capability to synthesize cholesterol, enough for you to live. Excretion. Conjugated bilirubin will be excreted, cholesterol, hormones, and drugs. Storage. Have the capability to store glycogen, and that is the reason why if you don't eat for some hours, you are not collapsing and dying immediately, because I can release part of my storage for you to live. Glycogen could become broken down in a process called glycogenolysis or gluconeogenesis. I store vitamins and minerals as well. Metabolism. Every drug you take in your mouth will pass through me, giving first-pass effects or pre-systemic metabolism. I help the metabolism of fats, proteins, and carbohydrates, and I detoxify blood generally. I have a lot of enzymes, and I activate them. Bile production. I can produce the bile and at the same time participate in transporting and excreting it. I'm capable of reporting ASOS to appropriate causes. Liver function tests will show that I'm no longer capable of my duties. And liver enzymes will show the degree of insult already inflicted on me. When it comes to alcohol, and you are hiding from your partners or your loved ones, just get GGT and that can expose what you've done. Because GGT in me, when it is 10 times the upper limit of normal, the physicians know that you have loaded me with alcohol. What makes me big? That is, some will call me hepatomegaly. Well, I'm not just big. It might be reduced lobe, that is the downward tongue-like projection of the right lobe, mimicking hepatomegaly on physical examination. Well, that is benign. It might be elongated left lobe called beaver tail liver. That could be confused with hepatomegaly or cirrhosis. Might be papillary process that may extend posteriorly between the inferior vena cava and the aorta. That could also be misdiagnosed as hepatomegaly. Still, if you are confused, why am I so big? It could be polycystic liver disease in autodominant adult polycystic kidney disease. It might be Budd-Chiari syndrome or biliary atresia. It might be biliary cirrhosis or primary sclerosing cholangitis or hemangioma. You are still not sure why I'm big. Well, you may look out for adenomas, hepatocellular carcinoma, or cholangiocellular carcinoma. It might be lymphoma. Can even be multiple myeloma, leukemia, or secondary metastasis to me. You are still not sure. Why am I big? Well, maybe you need to visit your cardiologist because it might be heart failure, particularly right heart failure. Might be infiltration into me with granulomas, amyloid, or tumor cells. Can even be as a result of inferior vena-cava web or Caroli disease, which is abnormal dilatation of the intrahepatic bile ducts. Might be sinusoidal obstruction syndrome or perniosis hepatitis. Might be Woman disease or hemochromatosis, which is the buildup of excess iron in the body. Still, you are not sure why I'm big. Might be alpha-1 antitrypsin deficiency leading to emphysema, on account of which pulmonologists will be helpful because the patient might present with COPD, and the main cause might be because I'm not up to the task anymore. Might be Gallagher disease, lysosomal storage disorder, or non-alcoholic steatohepatitis. Diabetes mellitus that is poorly controlled might be the cause of my enlarged side right now because of increased glycogen storage. And of course, wheezing disease, which is accumulation of copper. Still not sure why I'm big. Why don't you check out if there's autoimmune hepatitis already or drug-induced hepatotoxicity? Might be alcoholic liver disease or alcoholic hepatitis. It could even be shock liver or ischemic hepatitis. Parasitic infection like amoebic liver abscess might be the cause why I'm big, or granulomatous hepatitis, or bacterial liver abscess, or acute viral hepatitis or chronic viral hepatitis. My enemies have been identified, and I'm ready to name them. The commonest among all the enemies will be the viruses. They hate me a lot. And that is why I can come down with viral hepatitis A, B, C, D, or E. But D cannot harm me without working along with B. So, until I have acquired hepatitis B before hepatitis D can do me any harm. Bacteria are also named here. And sometimes I have spontaneous bacterial peritonitis when I'm down with liver cirrhosis. Other enemies are autoimmune conditions. Another enemy that you always throw at me is alcohol. And you deliberately, many times, throw your street drugs at me. And your helpers, physicians, nurses would have given you prescription drugs, but deliberately you take them indiscriminately. And even when you take prescription drugs appropriately, many of them are harmful to me. And your pharmacist would have told you there's hepatotoxicity as side effect. Throw all these enemies at me. I could still identify some other enemies as over-the-counter medications. Do you know what? Your Tylenol can destroy me. or your paracetamol. Herbs, no measurement, no dosage, you can kill. The granulomas, the copper, iron, cancer cells, and parasites, like I've mentioned earlier, they are all my enemies. I need to tell you a bit about my cirrhosis. You know it to be liver cirrhosis. It will be in stages. The inflammatory stage, the fibrosis, and scarring leading to cirrhosis, after which I will start failing, called liver failure, and there will be spontaneous bacterial peritonitis. So those who are diagnosed with liver cirrhosis wouldn't have gotten into the problem overnight. These will go through stages. I have a lot of friends, or I call them helpers. They can help me when I'm in trouble. So physicians and nurses should go through this list. When I'm in trouble, look for the one you can use to help me out. IV fluid or generous fluid. Albumin, because I won't be able to synthesize albumin anymore. Spironolactone when I have ascites. Metolazone in ascites is the same as Frosema. Vasibin, and nurses know that lactulose will help my host when I'm down with hepatic encephalopathy. Regulated interferon or ribavirin. Still, some of my friends that could help me out of problem will be N-acetylcysteine, particularly when you've thrown your acetaminophen, Tylenol, or paracetamol at me. N-acetylcysteine will bail me out. Penicillin G or silibinine could help me. Activated charcoal when you either inadvertently or accidentally send your toxins. Before it gets to me and destroy me, you can use activated charcoal if you do that quickly. And when I'm in trouble, please don't take all the protein grams that you have at home. Decrease that to 60 milligrams per day. Please, when I'm sick, don't bring your sedatives near me. I hate them. Penicillamine for life when there is copper accumulation known as wheezing disease. Still among the friends and helpers you can use when I'm in trouble will be Zaclovar. Bosbuva if I'm down with hepatitis C, and many other good antiviral agents like ABT530, Ebasava, Ledipasva, Dasabuva, Umvitasva, Pariteprivia, Daclatasva, and so on. Also, and finally, to help me in trouble or when I'm in need, you need to know that 40% of liver failure will recover. You might be lucky if when I'm sick, I have that capability, then you're fine. If not, you might need surgical intervention to help me out, like transjugular intrahepatic portosystemic shunt, paracentesis. But you know what? The best help I want is take me out of that body and get a new member of my family in there. Transplantation. That is the cure. Some accuse me of being bitter. or having a bitter taste? Oh, well, I'm sorry. It's because of the bile that I produce. You know what? The bile that I produce contains bile salts, cholesterol, bilirubin, bicarbonates, phospholipids, water, and waste products. I need all those to help in emulsifying fats for easy digestion by lipase. And the bicarbonates in my bile will neutralize the hydrochloric acid from the stomach because the duodenum and the enzymes there will need the medium to be in alkaline state. Some said that I can't sense anything, that I have no sensory, no part in me. That is wrong. There's an entity known as hepatic sensing. I can sense changes in blood osmolality. I can detect the water you take before it's having systemic effects. I can also detect ion changes like sodium and glucose low or high level. I can sense the lipid and thereby have the capability to control the feeding pattern. Do I have any blood supply? Yes, of course. I have 30% of my blood supply from hepatic artery, 70% from portal vein. That's a combination of superior mesenteric and splenic vein, and also from the left gastric, the cystic, the right gastric, and pancreaticoduodenal veins. Note this, the portal vein in me has no valves, with low pressure between 3 to 5 millimeters of mercury. I have venous drainage as well, the intrahepatic vein that coalesces to right, left, and middle veins. And then they drain superiorly into the inferior vena cava. The left and middle can drain directly into the inferior vena cava, but usually through the common trunk. Innervation. I have peripheral nervous system. That is the combination of somatic with autonomic nervous system. The autonomic nervous system could be the sympathetic, parasympathetic, or the enteric nervous system. Now, my associates. I'm not doing all that I've been doing by myself alone. I have people that are working with me, and we form a network known as biliary tree. And we are like a manufacturing company producing bile. Myself as the liver, here registered, the gallbladder, the pancreas, duodenum, and of course the kidneys, each forming different firms or units. From me, the liver will be the right and left hepatic duct coming together as common hepatic duct. That's the main producer. The gallbladder will have cystic duct. When it joins the common hepatic duct, it will form common bile duct. The gallbladder will serve as the warehouse where we'll store the bile. The pancreas is another neighbor working along with us, producing its own enzymes and transporting it through pancreatic duct. The pancreatic duct will transport the contents from the pancreas. Now, the common bile duct with pancreatic duct will enter the duodenum at the ampulla of Vata. That will serve as the border. The content will get into the duodenum with the help of sphincter of OD and cholecystokinin. They will serve as immigration agents. Cholecystokinin will influence the gallbladder contraction and relaxation, and sphincter OD will regulate the opening and closing of the pipe into the ampulla of Vater. The content will emulsify fast, used by the enzymes in the duodenum. Therefore, fast and the enzymes will serve as consumers of our product. If you want me to stay alive, you can help me. You can do that by stop smoking cigarettes. Decrease your alcohol consumption. Avoid saturated fats. Embark on the process of weight loss. Increase your exercise. Drink clean water. Eat fruits and vegetables. Still, if you want me to stay alive and working for you for long years, continue with balanced diet. Don't put toxins that will come and hurt me. Stop indiscriminate use of over-the-counter, street, and prescription drugs. Better still, it will be better if you can replace me when I'm sick and I can't serve you anymore. And that is transplantation. I hope you've received my letter and you will give me a reply and you will help me to stay alive. Message from the liver, the largest organ in your body, serving you every second, every minute, every hour of your life. Thank you.